Okay, today we're going to be looking at the hip and the muscles that you will be held responsible for, as well as the ligament. First thing we're going to do is start adding the ligaments. This is the ventral sacroiliac ligament that we talked about earlier when we looked at the SI joint. What we didn't talk about before was the superior pubic ligament, as well as the interpubic disc and the pubic symphysis. This is the pubofemoral ligament. You will be responsible for knowing its attachments and function, please. If we rotate, we'll find the ischiofemoral ligament here. Here's the inguinal ligament right here. Moving from the back, this is the sacrotuberous ligament. Going up a layer, we now have the sacrospinous ligament. And we now see the iliofemoral or Y ligament. You'll need to know those are the three main ligaments. We have the pubofemoral, ischiofemoral, and the iliofemoral ligaments. Their attachment points and function, please. We've just added obturator externus. And of course that would make this obturator internus. You're going to want to know their attachment points and function, as well as nerve and artery. Going up a level, we now have quadratus femoris, the pectineus, adductor magnus, gracilis. Obturator externus is still visible here. Of course, we've talked about this. This area here is the cojoint tendon of the iliopsoas, making this psoas major, this the iliacus. This is gluteus minimus. Now added the glute med, glute max. It's important to note that glute min, glute med, and glute max all attach to the iliotibial band. What also attaches to the iliotibial band is the tensor fasciae lata, this muscle right here, which you can see here. And then here's the actual iliotibial band, or iliotibial tract, as it attaches to the ilia here. And then you've got glute max attachment, TFL attachment, glute med, glute min. I've changed the view in primals so that you can see a better appreciation of the adductor muscles. This would be adductor magnus. This area here is the adductor hiatus. That is the gracilis, and that is the pectineus. Moving up a layer, we now have adductor brevis and adductor longus. We've also now added the vastus medialis, the vastus intermedius, and if we rotate this just a little bit, we'll see vastus lateralis here. And of course, this would be rectus femoris. Turning to a posterior view, you can also appreciate the size of adductor magnus there, semimembranosus, semitendinosus, and the long head of the biceps femoris. We'll go down a layer or two to find the short head of the biceps femoris. It should be noted that the semitendinosus proximally attaches with a cojoint tendon with the long head of the biceps as well. Okay, so we're looking at obturator internus here. We're now going to add a bunch of muscles. At this point, you are now seeing the inferior gemelli and the superior gemelli. So from a standpoint of orientation, you have the superior gemelli, obturator internus, and then the inferior gemelli. You'll see that quite well in the cadavers, and of course this is quadratus femoris, and then the piriformis. The piriformis is kind of our favorite muscle in physical therapy. Also going to have to know the sartorius. See, it's very long strap-like muscle, and that's going to attach to the pes anserine. So speaking of the pes anserine, when you say sartorius, it's distal attachment. Don't try and memorize all this stuff. Just say pes anserine, and we'll get to that when we look at the knee. I do want you to think about just the immense size of the iliotibial band.